Welcome to Facial Plastics Friday. It's Dr. Brace here. I asked you guys for some ideas for what you want to learn about on Facial Plastic Fridays, and this one came through on our messages, and the question was blepharoplasty or brow lift? Which one and why? And so let's go through it because it's a great question and it's often not just a bleph or just a brow, it's often both of them. And so what do both of those surgeries do? Let's get into it. So an upper blepharoplasty is a surgery to remove the excess eyelid skin, and that's what that does. So a skin pinch upper blepharoplasty removes eyelid skin. You can also remove some of the orbital fat if somebody has too much of the fat in there that's bulging and becoming like little eye bags. But most of the time we want to preserve the volume around the eye, and we actually do a transposition where we free the fat up and we move it into an area of hollowness. You can remove excess muscle, but that is a pretty antiquated technique, and I can pretty honestly say I've never removed muscle from an upper eyelid. It's almost always just excess skin. Now where people get a little bit confused or they get disappointed with the result is they say, I don't want a brow lift, I just want an upper blepharoplasty, and we remove the extra upper skin, and they come back and they say, I think I need a revision because I still have this heaviness right here. All this skin right underneath the eyebrow, we call that infrabrow skin, and it's actually forehead skin. And a blepharoplasty doesn't touch that. The way to get rid of the heaviness of the brow is not by removing eyelid skin, but by lifting the brow up. And there's different ways to do that, different techniques for a brow lift. So the answer to should I have a blepharoplasty or a brow lift is it depends. If you have a brow that's up in a great position, so for a woman that would mean that the eyebrow is above the bony orbital rim here, so if it's sitting up nice and high and you just have a little extra skin, it's a blepharoplasty. If you have a really tight eyelid but a droopy brow, it's a brow lift. But if you're like most people and as you've aged, the brow has come down, and it usually comes down medially or this way because there's the frontalis muscle lifts right here, but it's deficient out in this side, so there's nothing lifting it to the side. So this comes down, creates heaviness over the outer corner of your eye and crowding of the skin on the upper eyelid. The answer really is to rejuvenate your eye, you need to do both. You need to do an upper blepharoplasty and you need to do a brow lift. And that's something that you can tease out on the phone with one of our patient care coordinators, and if there's any confusion, we could definitely tease it out in a consult. But I'd say 90% of the time when somebody needs an upper blepharoplasty, they'd also benefit from a brow lift. And that's basically how we decide what to do, is what's that brow doing and how much of the heaviness is contributing to your eye from the brow position itself. So stay tuned because we're going to go into how do you do a brow lift next week, and that's going to be our next topic. Everybody have a great Facial Plastics Friday.